Hello, friends. Yes, good evening, everybody. I want to talk about one of the topics I've already discussed previously. And the reason why I'm going back to it is because of the type of reaction it generated from people. When I said that folic acid is very essential when you are pregnant in order to prevent um, neural tube defects. Neural tube defects are congenital anomalies. They are defects that are seen along the axis or neuroaxial plane. It could be in the head or the skull, the brain, the neck, the spine, down to the sacrum of the baby, right? It can cause a protrusion. It can make the head to be large. It can make the head to be small. It can be in a situation where part of the brain is not well formed, or part of the skull bone is not well formed, or is poorly formed, or there is a protrusion, an enlargement around the neck, around the back, around the lower back, or around the sacral area, such that these defects I'm talking about, they affect the neurological function of the baby when the baby is born. So that, and some of them are so deleterious that the baby may not even survive few hours after giving birth. For instance, the one we call anencephaly is where part of the skull and an aspect of the brain is not well formed, or they are completely absent. So when you give birth to such babies, few hours later the baby will just die. Even when you give the best care to that baby, in terms of neonatal resuscitation and admission into the newborn, neonatologists will not kill themselves. They will give the maximum of the support they could give. But the issue is that part of the brain, some aspects of the brain tissues are not well formed. Even the brain skull, the skull that covers the brain, may not be well formed. In fact, some textbooks have described that baby as a baby that looks like a frog eye sign. That's what you see on ultrasound when you are doing a scan to detect that kind of anomaly on ultrasound. Are you getting me? So, and there is simple solution to it. What is the solution? Just take folic acid. Start taking folic acid as a reproductive age woman from 15 years to 49 years. These are reproductive age range. Keep on taking folic acid every day. One tablet is enough for you daily. It will help to prevent these neural tube defects. Now, the reason why the World Health Organization is saying take folic acid every day if you are within the reproductive age is that if you are not aware you are pregnant and you become pregnant and you are taking this folic acid, there is chances that those things, anti-folates, that you may be exposed to, will be completely counteracted by the folic acid you are taking, such that those antifolates will not remove or will not deplete the folic acid level in your system, thereby not affecting your developing fetus. But if you are not taking folic acid, it means that you'll be exposed, and then you will develop neural tube defects. Your baby will develop neural tube defects, and when the baby is born, you will see all sorts of complications or congenital malformations. We have published a case of uh, Mamet syndrome. Mamet syndrome is such a congenital anomaly where the baby's legs are fused together, and it appears as if the baby has one lower extremity, that's one leg, and then there's no genital, no sex organ in that kind of baby. So tell me how that baby looks like, just like mame water. That's how that baby looked when the baby was delivered. So, and the simple truth is that there are certain environmental exposures that affect the folic acid level, that we inadvertently take, or that we inadvertently get exposed in our environment. So such things, in such circumstances, we are advised to be taking folic acid, at least one tablet daily, if you are within reproductive age range. Now, if you have had an abnormally formed baby in the past, you must start taking high dose folic acid at least 3 months before you become pregnant, and continue throughout pregnancy. So apart from trying to prevent neural tube defect for you, folic acid is also a hematopoietic ingredient. With it, your hemoglobin will be built up in order to prevent anemia during pregnancy. So you can see that there are so many benefits of taking folic acid. So we are not just saying it for saying sake. So in this video, I want to advise you to keep on taking